This is lecture 13.5 for Psych 440, Training Outcomes. So in this lecture and the next, we're going to talk about how we evaluate training. And in the IO literature, training evaluation for a long time has centered around a model called Kirkpatrick's taxonomy. So we're going to talk about Kirkpatrick's 4 levels of training criteria or training outcomes and how we might go about testing each one in organizations. We'll also start talking a little bit about some of the obstacles or barriers to collecting each of these different types of outcome data. So to get started, training evaluation is critically important. You probably know from your own experiences that just going through training doesn't necessarily mean that you learned anything. And even if you learned something, as we talked about in our discussion of transfer of training, that doesn't necessarily mean that you're going to take that new information that you learned and apply it on the job or change your behavior in any way. Because training is a $51 billion industry, it's rather important for organizations to figure out whether their training is doing what they expect it to do. If it works, that's grounds to continue the training, to keep doing what you're doing. If your training doesn't work, you need to fix it. You need to change the direction or find out what's not working about your training. So in industrial psychology, we have been thinking about how best to evaluate training for a very long time. And we rely on a model that's been around for quite some time, but it's proven to be a pretty effective, pretty useful way of thinking about it, called Kirkpatrick's taxonomy. Kirkpatrick proposed 4 different levels or sets of criteria we can use to evaluate whether a training program worked. The first level in Kirkpatrick's taxonomy he called reaction criteria. The next level up from that is learning criteria, followed by behavior criteria, and finally results criteria. His taxonomy is hierarchical, the idea being that the levels that are lower in the model, reactions and learning, those happen closer in time to the training than behavior or results criteria. Those would be evaluated later. And typically, the lower the level, the easier it is to evaluate. Reaction criteria are very easy to capture. Results criteria can be very difficult. So over the next few slides, we'll go over each of these in more depth. Reaction criteria mean, how did the trainees feel about the training? Did they like it? Did they enjoy it? Maybe more importantly, did they think it was worthwhile? Did they feel like the training taught them something and that they learned something? Typically, reaction measures are administered right at the end of training or very, very soon afterward. This measure is often criticized because just because employees liked training doesn't necessarily mean that they got anything out of it. It might have been very entertaining or fun, or maybe the food was good and so they feel positive about it. It doesn't necessarily translate into any of the later evaluation criteria. On the flip side, though, if trainees react negatively, even to a very good, very well-designed training program, if they perceived it as not particularly helpful or unpleasant or negative in some other way, then they're unlikely to use it. They're unlikely to try to retain the material they learned or to transfer it to their jobs. So positive reactions don't necessarily tell us much, but negative employee reactions to training can tell us a lot. Another important reason to pay attention to reactions is that employees who have a response to a training program are likely to go back and talk to other employees about how they felt about that training. So if they leave with positive reactions, they're likely to go say good things. Then other employees who have the opportunity to go to that training are likely to come in with good expectations. On the other hand, if employees really disliked a training program, their views are going to shape the expectations of other employees in their work group who might have to take that training in the future. So reactions aren't everything. In fact, they don't tell us much in terms of whether the training really worked, but they are still valuable and important in their own right. One thing that's a little unusual about reaction criteria is that they often include, beyond just, hey, did you think this training was useful? Did you think it was valuable? Was it important to your job? It also includes very practical things. Was the room nice? Was it too hot, too cold? Was the equipment good? How was the food? Again, from a theoretical perspective, these aren't very interesting, but they do shape those overall reactions. Comfort and good environment and feeding people well plays a surprisingly large role in how much attention they pay to the training and how they respond to it. So reaction criteria are kind of a balance between things that are really of strong interest in how is this going to affect the training going forward, and did we get the practical details right. Out in the industry, you'll often hear these referred to as smile sheets. Typically, most people's reactions to training programs tend to be fairly positive, especially if we're asking about things like the room and the food. That kind of reflects the fact that they don't really tell us what we want to know about whether the training was effective. However, they're easy, they're not difficult to collect, they're not difficult to write. There's not much reason not to evaluate reaction criteria. Moving to something a little bit more complicated, the next level in Kirkpatrick's taxonomy is learning criteria. Okay, you liked the training. Did you learn anything? At the end of the training, do you know what you were supposed to have been trained on? So when we assess learning criteria, we're typically using things like knowledge tests, or we have some sort of assessment set up where we ask trainees to demonstrate the skills that they learned. This is much harder to write than a training reactions measure, because we have to figure out what's an appropriate, criterion valid, content valid way to assess what they learned. So learning criteria are automatically more challenging than just reaction criteria. It's important to keep in mind, though, when we talk about learning criteria, that we're not just limited to knowledge. Certainly, knowledge outcomes are an important result of lots of types of training, but that's not the only thing we're interested in producing change in. So we can break down learning outcomes into different categories. Knowledge is often described as a cognitive outcome. Do you think differently? Do you know stuff that you didn't know before? We could also assess skill-based outcomes. We can even assess affective outcomes or changes in attitudes. If the training that you're evaluating is about something like diversity, affective or attitudinal outcomes might be a very important thing to measure and change. The important thing is that our criterion measures for assessing learning match what it was we were trying to change. It doesn't necessarily make sense to, well, if we were developing, say, a sexual harassment or a sex discrimination training program, it might be a little informative to have an assessment at the end. Do people know the facts about sexual harassment? Do they know what the organization is legally liable for or not legally liable for? It might be more important, though, to assess affective outcomes. How do you feel about working with people whose gender is different from yours? How do you feel about using the organization's grievance processes now? We need to match our outcome measures or our learning assessment measures to what it was we wanted to change in the training. So learning criteria and reaction criteria both get measured right around the end of the training program, very close in time to when the training happens. Behavior criteria are assessed sometime later because behavior criteria are connected to transfer of training. Once employees have been trained, once they've gone back to the job, are they using what they learned? Chances are if we evaluate this immediately afterward, we're going to see high transfer, but what we really want to know is 2 weeks later, 6 months later, are they still using what they were trained on? This one can be very challenging to evaluate. Some of the strategies we use, very often behavior criteria are evaluated via supervisor ratings. We might use performance appraisals for this, We might use a more direct assessment where we say, hey, your employee so-and-so went through this training 6 months ago. Would you please fill out this form and tell us how many of these behaviors that person is currently doing? For knowledge kinds of measures, cognitive outcomes, we might follow up with a knowledge test or a skill demonstration assessment sometime afterwards. You could do this at the end of training. Do you still follow the right procedures? Is it still working the right way? Sometimes we assess behavioral criteria through direct observation. If we had customer service training, we might assess the effectiveness of that training by sending in secret shoppers 6 months later. So behavior criteria are more effortful to capture. We have to be a little bit more creative. We typically have to, because we want to capture people in their work environment. What are they normally doing on the job? Then the final level of training outcome criteria is results criteria. Results criteria is concerned with the effect of the training not on an individual employee, but on the organization as a whole. So if we used a complex customer service training program, did our customer service scores as an organization get better? If we engaged in safety training, did our accident rate go down? So the 3 previous levels are all focused on evaluating the individual who was trained. Now we're focused on evaluating a group, all of the employees who experienced the training. Does it make a difference for the organization as a whole? One specific form of results criteria, not all results criteria are ROI, but some results evaluations will look at return on investment, which is looking at this specifically in financial terms. If our performance improved, what's the financial value of that improved performance? And how does that compare to the cost of training? If our accident rate went down by 0.5 percentage point, 0.5 percentage point doesn't sound all that exciting, but how did that affect our insurance rate? Some organizations that work for the federal government have to report their accident rates in bidding for government contracts. Did that 0.5 percentage point improvement in safety, did that translate into now we were able to bid on more contracts? So translating things very much into financial bottom line terms and comparing that to the cost involved in implementing the training program. Of these 4 levels, how far do you think most organizations go in evaluating their training programs? What we see in most training evaluations is that most organizations evaluate reactions. Many, though not even quite the majority, evaluate learning criteria. It's much, much more unusual to see organizations evaluate behavior or results criteria. The further you get from the training program, the harder it is to make those evaluations. It's hard to track down supervisors 6 months later and get them to fill out ratings. It's hard to get that organizational level performance data to even figure out where should that change in behavior show up in results. It's more effortful, it's challenging, and you have to be patient. You have to wait to get those higher levels. So most training programs, frankly, most of them stop at the reaction level. Training programs implemented by a training department or a serious consultant will often incorporate learning criteria because that's at least a way to show that you think it's working, that at least you learned something, but it's very rare for an external consultant to be able to stick around the organization long enough to get behavioral criteria or get access to the data for results criteria. So unfortunately, what we should be doing and what we do in organizations is not necessarily the same thing here. This is an ongoing struggle for most training and development practitioners. We're investing a great deal of time and resources, financial resources, human resources in training programs. We often don't go to the trouble to see whether or not they work. Our next topic, we're going to talk about what we would need to do, why it's so challenging to design a good training evaluation, and how that connects with what you already know about research design.